Are robotics the answer to taking care of Korea's rapidly aging population? That and more on Korea Technology Weekly. Hi, I'm your host, Dr. J.R. Reagan. In this episode, we'll be discussing South Korea's plans to use robotics to help ease the strain on hospitals and the broader healthcare ecosystem. The world is aging exponentially, with 617 million older adults in 2020, with the figures expected to jump to 1.6 billion people by 2050. Given the numerous simple and complex health situations that accompany geriatric populations, an increase in older adults could overwhelm our healthcare system if we don't deal with it now. South Korea is fast turning gray. Like many other nations, South Korea is facing the challenge of meeting the needs of a rapidly aging population without wrecking its finances. The country currently has more than 6 million people above the age of 65, out of a total population of slightly over 50 million. This population segment is projected to grow to more than 8 million by 2020. The country's population of citizens aged 65 or older is forecast to hit 37% by 2045, surpassing Japan's 36.7%. So what does this mean for South Korea's healthcare system? As the country ages, hospitals are turning to robots to support caregivers, reduce elderly isolation, and tackle COVID-19. South Korean robotics are envisioned as part of the likely medical care for many of these older population. The South Korean Ministry of Health and Welfare invested 1.3 billion Korean won, which is about $1.1 million in 2019, for developing care robots for the elderly and disabled. The multi-phase project commenced in anticipation of the growing aging population and increases in demand for elderly care. Since 2012, the State Rehabilitation Institute has supplied 120 rehabilitative robots to hospitals and community health centers to aid patients, the elderly, and the disabled who have mobility difficulties. The National Rehabilitation will commit to developing care robot technology to reduce the burden for caregivers and improve quality of caring service for care recipients. Healthcare robots are one solution, helping to ease strain on hospitals and wider care ecosystems. South Korea, already known for surgical robots for minimally invasive surgeries, is now seeing a surge in the use of robots outside of the surgical theater. South Korea also announced a series of investments into robotics research and development for 2020, including $250 million to develop service-oriented robots for areas such as healthcare, rehabilitation, and disaster response. What's more, there are plans to turn robotics technology into a $13 billion industry. There is a growing social robot industry that caters to the unique needs of the elderly. As of 2017, over 600 domestic robotics companies are operating in South Korea, many of which are focused on elderly needs. Pibo, a companion robot created by a South Korean startup, is making a difference for the elderly that live alone, helping with simple household tasks and holding conversations. Another startup is creating a robot to help prevent dementia by engaging the elderly with puzzles and games. It is being used in 25 clinics and senior citizen centers around South Korea. Healthcare robots are also helping hospitals to cope with the current COVID-19 epidemic. The Temi robot, for instance, now features a thermometer and food and drinks tray. The robot brings meals to quarantine patients and allows them to communicate with loved ones and doctors remotely. More broadly, healthcare robots are transforming patient experience in the country. Take Sun Medical Center in Daejeon, where I live, for example, which has introduced a concierge bot. It helps patients not only with navigation, but for example, you can put in your symptoms and then the robot tells you where to go or what examination you have to do. You can talk to the robot and also get guidance. The robot works in tandem with a mobile app to help patients in wayfinding. It also lends a helping hand in logistics. It can lift heavy loads of linens or disposables up to 100 kilograms and works 24 hours a day and even has its own dedicated elevator or lift. The hospital has an innovation committee that leads these robotic initiatives, made up of professionals across different functions. physicians, nurses, designers, IT developers, and administrators. A dedicated innovation team is used to upgrade the digitization regularly. Hospitals in South Korea will also use robotics to transport materials and assist in patient rehabilitation. 10 to 15 robots will be placed in hospitals to transport supplies and medical devices, while another 5 to 10 will be used in rehabilitative treatment in state-run hospitals. While healthcare workers across the world are exposed to high risks of infection during the COVID-19 pandemic, Korean hospitals have come up with a solution to this problem using advanced robotics technologies. In South Korea, ubiquitous robotic companions that use 5G technology and artificial intelligence are in operation at many hospitals. These medical institutions have decided to make active use of the robots, not just to protect workers from infections as initially planned, but also for other purposes. Among those using robots are Seoul National University Hospital, Samsung Medical Center, and Myeongji Hospital, where robots are providing various services such as cleaning, disinfection, guidance, fever detection, and delivery. Seoul National University uses 2 robots, LG Cloy CleanBot and LG Cloy GuideBot, to clean the hospital and guide visitors. Seoul National University Hospital has introduced the robots to clean the hospital, control visitor access, and measure fever. LG Cloy CleanBot can clean even the intricate hospital halls armed with technology to avoid obstacles and navigate autonomously. It is also equipped with medical-grade H13 high-efficiency particulate air or HEPA filter to maintain a clean environment. LG Cloy GuideBot helps with basic respiratory checks and body temperature measurements. The hospital has measured fever and tested all visitors since COVID-19 hit Korea in January of 2020. It can also sharply reduce the risk of infection by carrying out the tasks done by healthcare workers and converting face-to-face checks into contactless or untacked interactions. Samsung Medical Center, or SMC, has also implemented 6 medical support robots that can sterilize negative pressure rooms, transport medical waste, and detect fever. The 6 medical support robots, 2 for each function, are being leased for free until the nation entirely puts COVID-19 under control. The robot is able to disinfect negative pressure rooms, has a built-in function to beam eco-friendly ultraviolet LED, and also has an air sterilizer. The robot can even disinfect blind spots that are out of reach with moving arms and operates at all times. Samsung Medical Center placed a fever checking robot for general visitors at the hospital entrance and the lobby. The robot is equipped with a thermal imaging camera, adjusting to the angle to visitors' heights when they look at the screen, and automatically measures their body temperatures. When a symptom is found, the nearest screening clinic appears on the screen and a voice prompts to confirm body temperature. It also dispenses cleaning fluid using contactless sensors. An additional type of robot transports clothes and medical waste used by healthcare providers and patients. It is programmed to recognize a person's appearance, follow the operator, or move by itself according to an input path. Myeongji Hospital in Goyang, just north of the capital, Seoul, offers remote treatment and safety checks by using robots at its screening center, which is operated to prevent the spread of COVID-19. The hospital separates the screening process into 2 stages. It uses RP Lite V2, developed by a telehealth solution company in South Korea, in the initial checks. RP Lite V2 is armed with a high-definition camera and monitor, checking the face of medical workers and patients by zooming in and zooming out functions and connecting with a smartphone through Wi-Fi. After checking visitors' body temperatures, the hospital treats people with a temperature of higher than 37.5 degrees Celsius at the screening clinic. If further medical help is needed, the hospital carries out a remote consultation by connecting the robot to a doctor's smartphone. The robot is connected to multiple people simultaneously and helps specialists in various fields diagnose patients simultaneously. As South Korea faces the question of how its graying population can age happily and healthily, healthcare robotics forms one part of the answer. They also represent new ways to serve patients quickly and more efficiently so that hospitals can cope with ever-changing needs. Robotics may be the answer to taking care of Korea's rapidly aging population. That's all for this week's show. Follow me on Twitter or LinkedIn at Idea Explorer or my website ideaexplorer.com. Feel free to leave comments or suggestions about the show and tune in next week for more news and trends about Korea technology.